what you learn in an MHA program is kind of a blend. You learn the basic managerial skills that you would get in any business degree program at the master's or advanced undergraduate level. So you learn basic managerial skills. You learn about the healthcare field. You learn how those managerial skills are applied to health. Many of our graduates end up in hospital positions, and that's probably the largest group do end up start out at least in hospital management positions, department directors. Occasionally they'll graduate and become assistant administrators, usually of small hospitals, analysts, special projects coordinators, and then they will gradually move up the line. And we have now, many of our alums are CEOs of hospitals and hospital systems. Others will start out in the hospital setting and then move into ancillary positions outside the acute care hospital. Practice management, consulting firms, organizations that serve hospitals and the healthcare industry in various ways. The class that graduated last year, there were 25 in our full-time program. 24 ended up working in healthcare organizations, and the last one ended up in an ancillary service that serves healthcare. Healthcare management is a field where you can do good and do well. Our students make a decent living, but they also feel that they're making some kind of contribution to society. And all of them will come here with that mission in some ways. And we expect an applicant to have done their homework and have some kind of understanding of what healthcare is all about. And if they don't, we maybe suggest to them that they wait a year and go out and find a job in the field. And if they can't find a job, then at least volunteer in a hospital or other health care organization. And in fact, one of the things that we do now, one of the strategies we use with our students on campus is to try to get them involved either with a paying job while they're a student or on a volunteer basis in a local healthcare organization. That enriches their understanding as they go through our curriculum. It also helps to build their resume as they start looking for a residency placement. It's a one-year residency program that is part of our field, our program of study. It's prior to graduation. And in that, the students are working in healthcare organizations, so they're both students and learning to be practitioners. It's a wonderful opportunity. The residents have access to information, typically, that they won't have again for many, many years. They often attend board meetings. They'll go with their preceptor, the CEO, in many cases, to all kinds of high-level committee meetings. And they'll just learn, and they'll also have an opportunity to rotate through all hospital departments. And that includes anything from a clinical department to housekeeping to dietary, so that they learn the total picture of a hospital. It's a wonderful opportunity that the typical entry-level employee never gets to have.
We thought we should meet one of these administrative residents to find out if it's really that wonderful.
I've been with the organization since the beginning of this year, and started the year by getting involved in departmental rotations to get me a better understanding of the organization. I've also had the opportunity to work on a number of different projects, providing support to members of the executive team. One of the first projects that I got involved in this year was became a member of an outpatient satisfaction task force. I was working closely with our Vice President of Marketing Communications on trying to provide a better experience for our patients and their families when they come in for an outpatient procedure. We also looked at our ambulatory surgery process, and we really took an approach to kind of analyze each step that the patient went through, starting with admissions, going up to the lab, going to radiology, and try to streamline that process as much as possible. My preceptor this year is Don Beeler, who's President and CEO of Christus Santa Rosa Healthcare, and really we've had a wonderful relationship. He's really dedicated a lot of his time to me. He's had an open door policy. He's always welcomed my questions and invited me to all of the meetings that he gets to attend on a regular basis as CEO. You really have to make a name for yourself throughout the administrative residency. Again, taking the initiative and approaching different members of the executive team and offering your assistance and support with different initiatives that they're working on. And once you have the opportunity to work with one of the executives and they see the quality of work that you deliver, you start building some credibility and they start giving you more and more responsibility. And eventually that'll lead into a permanent position, which is the idea at the end of the residency. I've recently been appointed as assistant administrator here at Christus Santa Rosa. I think that the administrative residency as well as the Trinity program really prepared me for this new role that I'm about to take on. Initially, I'm going to start with 2 departments that I'll be overseeing, that I'll have operational responsibility for, and the lab and cardiopulmonary departments are those that I'm going to be taking on as my departments. I'm also going to be heavily involved with medical staff relationships and working to improve and maintain the relationships that we have with all of our physicians. I'll continue to be involved with patient satisfaction because that's something that everyone should be involved with in the organization.
Enrique's experience sounds amazing, but we thought you would like to meet some MHA students just starting out.
From the beginning of my life, I always knew that I wanted to do something in healthcare and service. But as I matured and entered college, my undergraduate education led me towards business and communication. And then after combining all those together, I knew that healthcare administration was the perfect match for me. And I also see it as just continuing the trend in my life of serving the community and trying to end some of the disparities that people deal with on an everyday basis.
My father's a physician, and I would go to his office a lot of times and just sit there and go into the patients' rooms and meet with some of the patients as well. And it just, I could see what a difference he was making in their lives, how he was talking to them, making them feel better. And as I went to college, I thought about healthcare, but I was also interested in IT. So I started with my career in MIS, and I went into that. But I just didn't feel connected to that industry at all. I didn't feel that connection that I felt when I was sitting in my father's office.
My undergraduate degree is in public relations. My first internship was at the state capitol, and I worked on the healthcare expenditure committee, but I really didn't know what I wanted to do at that point. And after that, I pursued a lot of different internships in entertainment, sports, you name it. But really, I kept on wanting to go back to healthcare because after exploring all of these other career opportunities, I knew that this was the only one that had a bigger meaning to me, that I could actually have an impact in people's lives. I thought about, my mom was in the hospital and how much it meant when the hospital administrator sat down with us and just how much better we felt, just knowing that we were in good hands, and I would love to be that to other people. And it's huge. It's an amazing industry. It's growing, and I'm really excited to be a part of it. I think it's even different than getting an MBA or a different kind of degree because we're all here for the same purpose and we all want to help people.
I think we're the new generation. We can bring new ideas, new talents and skills into this industry.
There's so many opportunities right now, and there's so many changes going on with policies and just integrating technology that I feel that we really can do anything that we want to and change how things have been in the past, correct some of the wrongs and put everybody back on the right path.
I want to work in a large hospital, maybe do something in marketing or do something in policy with the hospital and try to make a difference through legislation.
I can see myself working as hopefully a CEO or something, or as a hospital administrator in a major facility, but mostly focusing on women's and children's health. That's a passion of mine.
I see myself working in a system of hospitals and working on improving those small, minute details that may make a large difference in saving costs and saving lives, just making that difference.
This program is brought to you by the American College of Healthcare Executives, an international professional society of more than 30,000 healthcare executives who lead hospitals, healthcare systems, and other healthcare organizations. The leaders of the featured hospitals and health systems are board certified in healthcare management, having become fellows of the American College of Healthcare Executives, signified by the FACHE credential following their names. For more information, go to ache.org.